Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, PA. Last week we talked about the shoulder joint, and now this week we are going to go down into the elbow joint. So the elbow joint is a lot different than the shoulder joint. Last week we talked about the shoulder joint being a ball and socket joint, which is allow us to doing all motions of the shoulder. The elbow doesn't have that much range of motion. It's called a pivot hinge joint, which allows us to do flexion of the elbow, extension of the elbow, and rotation of the elbow. So the elbow joint makes up three different bones. Your arm bone, which is called the humerus, your radius, and your ulna, which are your forearm bones. They all connect together to make the elbow joint here. So many different muscles, many different nerves, many different blood vessels. Blood vessels, as far as the elbow joint, there's a lot of them. The biggest one is the brachial artery. The brachial artery starts up in this area here, runs pretty much all the way down, and supplies blood flow all throughout the arm, and supplies a lot of nutrients. Muscles, you have two different types of muscles. You have your flexor muscles and you have your extensor muscles. Your extensor muscles are in something called the lateral epicondyle, which is right here, okay? And these attach to your extension muscles and allows us to extend our forearm, extend our wrist. Then you have your medial epicondyle, which allows the attachment of flexor muscles, which allows us to bend our wrist, bend our forearm, and all that. So there's many different conditions that affect the elbow. You have osteoarthritis, you have bursitis, a lot of things we've talked about in the past. Two things I'm going to talk about mainly today is lateral epicondylitis and medial epicondylitis. A little bit more fancier terms, but terms that more people will know them as is golfer's elbow and tennis elbow. Tennis elbow is lateral epicondylitis, and golfer's elbow is medial epicondylitis. Now, does that mean that someone who's a golfer, do they have to get medial epicondylitis? No, they can get lateral epicondylitis, and vice versa with tennis players. Tennis players can get medial epicondylitis. How do you get these epicondylitis, or what we call elbow tendonitis? You can get it from just golfing and just tennis. Mainly it's due to repetitive motion. So in tennis players, they're constantly hitting the ball this way. Golfers, they're constantly swinging and hitting this way. Repetitive motions is the biggest cause of elbow tendonitis, but it can also be caused due to injury as well. Whenever something is overused, the muscles become inflamed, the muscles become overused, and it causes all that pain, and it can run all the way down the arm. So how do we treat elbow tendonitis? There's a couple different ways. First thing, the RICE protocol: rest, ice, compress, and elevate. That is the biggest key for that. Now, another big key is you want to lay low on the activity. You know, it could have been from tennis, it could have been from golf, it could have been from throwing a baseball, it could have been a number of things. So the best thing to do is to limit or stop that activity that's created the tendonitis completely for some time, but then once that's all resolved, you can go back to your activity. Another big thing that people will do, they'll stretch their wrist, because again, all these muscles in here and all these muscles in here attach to the elbow. So you want to stretch your wrist, stretch your elbow out as best as you can. That will help fatigue that muscle and help relax everything. Now, the last exercise that I have for you is what I call the rosebud claw exercise. What you do is you get a rubber band, a regular rubber band, and you put your fingers just like this. This is the rosebud position here. What you want to do is you want to make the claw position, and that's this here. And you can do that as much as you want. I can feel that in my flexor and extensor muscles attaching to my elbow. What this does is it fatigues your muscles, and it helps reduce the inflammation process along with your RICE protocol. So that's a really good stretch and good exercise to use for elbow tendonitis. Now, what can a chiropractor do? Chiropractor can do a lot of things. In 90% of cases, like we talked about last week, look where the elbow, the nerves of the elbow go to. They start in the neck. Most cases of elbow tendonitis that we see, or most cases of just elbow pain in general, we adjust the neck and the elbow will be corrected itself. Now, does that mean I'm not going to adjust the elbow? No, I do adjust the elbow, and sometimes the elbow is needed to be adjusted to help open up that, what we call the cubital tunnel, which is where the older nerve sits, opens that up, takes pressure off any pain, causing numbness or tingling even into the pinky of the finger. So those are things that we recommend. We have stim that we put patients on for elbow pain, elbow tendonitis. But again, in most cases, those patients are going to be a neck case. So that's all I have for you guys this week on the elbow. Next week, we're going to work our way down to the wrist. We'll talk a little bit about some conditions, mainly carpal tunnel syndrome. And then we'll kind of go on to our next topic that we'll discuss in the coming weeks. But that's all I have for you guys this week. If you have any questions, please feel free to reach out to us. Have a good day.